Hi dear parents, I am Dr. Aravinda Lochani, Consultant Neonatologist and Pediatrician at KIMS Cuddles. Today let us see about the common problem faced by children, which is the upper respiratory tract infection, and the precautions and the treatment for the same. What is upper respiratory tract infection? It is a irritation and congestion of the upper airway, that is most commonly the nose, nasal mucosa, the sinuses and the airways, that is the pharynx, without involving the lungs and the bronchi and bronchioles, which comes under the lower respiratory tract infection. So in this the symptoms will be the running nose, nose block, cold and cough, which may be dry in the initial stages and later on may become productive. These upper respiratory tract infections are usually caused by viruses. The most common viruses are rhinovirus, adenovirus, enterovirus, influenza and parainfluenza viruses, which cause these seasonal URTIs in children. They are self-limited illnesses which manifest with these above mentioned symptoms along with a mild fever and usually last for around 7 to 10 days. How do they spread? They spread by droplet infection and it is airborne, that is they spread from one child to other child. This is particularly common in school going children and also the children who go to daycare centers. Children who have reactive upper airway disease like asthma, they are more prone to get these upper respiratory tract infections frequently, and also children who are immunocompromised, like previously the child got admitted for some other reason and now the child is recovering, child is having some other problem like cardiac issues, they are also more prone for viral infections. So whenever a child gets this upper respiratory tract infection, what we should do as a parent? So the child should be kept at home, try to give them rest and try to give them plenty of water, and you can use the nasoclear drops or any other drops, saline nasal drops to clear the nose, as well as mucus suckers to relieve the blocked nostrils. Decongestants can be taken with the advice of your pediatrician. So they should be given in appropriate doses which differs from each child to child. So don't use these medicines as over the counter medicines. Always use them with the help of your pediatrician. So whenever the child has a running nose or cough or mild fever, you can use these nasal drops as well as decongestants and paracetamol for fever relief, and the child will get better in few days. If the child is not getting better, if the cough is becoming more and if the fever becomes high grade, then you should always contact your pediatrician at the earliest to rule out the more severe conditions like bronchitis, bronchiolitis and pneumonia, which is known as the infection in the lungs, which needs proper admission and treatment for the same. So how to prevent these upper respiratory tract infections in children? In the monsoon season, try to avoid taking them to crowded places. If the child is not well, try to give them a break from the school, and always maintain proper hand hygiene. The child should always wash the hands before eating food or before touching their mouth or nose, and if the child has a cold or cough, always he or she should wear a mask, and whenever they get cough, they should cover their mouth and nostrils so that they don't avoid the spread of the germs from one child to another. And we can prevent some of these infections like influenza infection, particularly by giving vaccines to the children, the flu vaccine before the onset of the monsoon. Thank you.